Hello and welcome to Breast Cancer Now's Facebook Live session. We're talking tonight about family history and high risk screening for family history of breast cancer. Tonight, I'm delighted to be joined by Dr. Helen Wall, who is a GP with a wealth of expertise in many different areas, but a specialist interest in women's health. Helen is also what she's here to really talk about tonight, though, is her family history of breast cancer and why. And the reason she's here is that she wants to share her story and the importance of going for your screening. So, but before Helen shares her story, I'd just like to say that if you've got any questions or comments for either myself or Helen, please do put them in the chat, and we'll try and answer as many as we can as we go through. Without interrupting Helen too much. No, that's fine. Actually, just ask the questions. That's absolutely fine. If we don't get round to answering them all tonight, we can answer them as soon as we can after the session's finished. And or what you could do is leave a message on the voicemail of the helpline, and one of our nurses will speak to you tomorrow when the helpline opens again tomorrow at 9 o'clock. So you can always give a ring to our helpline if you think of any other questions. So without further ado, I'd like to introduce you to Dr. Helen Wall. And Helen has a personal has a personal interest in family history and breast cancer in general, and she'll be telling you why in a moment. There's a commonly held belief that breast cancer is a hereditary and a genetic cancer in general, but in fact, breast cancer only accounts for about 5 to 10% of breast cancers are genetic. It could be more than that, but what the most common genes are BRCA1 and 2. Now, these genes generally they protect us against developing things like breast cancer and ovarian cancer. But if there's a mutated gene in any of those, then it can increase your risk of getting those cancers. And there are lots of other genes that give you a slightly higher risk of developing breast cancers and other cancers as well. But that's in a nutshell what genes do. But Helen, as I say, is a GP with a lot of experience behind her. But Helen, you're here to tell your story, aren't you, about why you think it's so important to share these details and why family history is very important to you. So, without further ado, Helen,
thank you, Addie.
thank you for coming.
Thanks. Good evening, everybody. So I am what we call high risk ladies, one of the high risk ladies in Greater Manchester, and what that for breast cancer, and what that means is that I am now part of a screening programme that started when I was 35, having an annual ultrasound because I was too young to have a mammogram, and then from age 40 having a mammogram every year. And I'll give you the backstory to how that came about, because I get a lot of patients as a GP who come in quite anxious about their family history of not just breast cancer, but we're here to talk about breast cancer, so we'll take that one, and want to know exactly, how this comes about, that somebody becomes a high risk lady that ends up on an annual screening program. So when I was 9 years old, my mum found a breast lump. She was 47 at the time, and the breast lump was investigated and unfortunately turned out to be estrogen and progesterone sensitive cancer, and it had spread into her lymph nodes. And in those times, it was the early 90s, late 80s, early 90s. At that time, the surgery was quite radical. I think there's much better surgical procedures now, but at that time she had to have a full what they called a radical mastectomy, which was the whole front of the chest wall removed, the axillary, full axillary clearance. So quite extensive surgery for a young
Yeah.
lady with young children, and I was the oldest of two children. And you think 9-year-olds don't really know what's going on, but I remember those days very, very clearly, like it was almost yesterday. My mum had extensive surgery and then had chemotherapy, and so on and so forth. And she recovered for a while, and then unfortunately, things returned, and she passed away. Um, and when she was extremely poorly in the hospice, when she was palliative, she told me that actually I'd never really known my mum's relatives because, well, they died, and I didn't really know what from. We'd never sort of come
No.
into that kind of conversation really. I'd met her dad, but I'd never met his sisters, and I knew that he had a few sisters. And it came to pass that actually most of them, 4 out of the 5 sisters, had actually died of breast or ovarian cancer,
Right. So quite a
which
strong
had never
family
really
history.
been talked about
Mm.
up to this point. Because I was, by the time my mum passed away, I was much older than 9. I was sort of heading towards 20. So we had this conversation, and she said that she'd spoken to the doctors in the hospice and her breast consultant and wanted some form of genetic screening to happen
Yeah.
for me, and basically made me promise that I would go through with that, to find out what if anything could be done to protect me from going on to develop
Yeah.
early breast cancer. And that's what we did. So I was then referred when my mum passed away. Obviously, didn't do anything straight away because everything was very um, sad. And then when
Mm.
things settled a little bit, I went to the GP, and they referred me on to St Mary's in Manchester because I'm Manchester based, and that's that's our local genetics service. And I
Mm.
had to go a few times, and I had to have various degree of counselling because I guess you've got to talk about what you're going to do with the results. And
Mm.
there was a discussion around if I did turn out to have the BRCA1 or BRCA2 genes, would I go and have prophylactic surgery? And
Yeah.
it had to. I think I probably went to the clinic probably 3 times to have various different discussions and
Yeah.
in-depth counselling about how I viewed it, what I would do. What about, because at this point I was
I was
a
going to
young
say, how old were
woman,
you?
probably 22 at this point,
Yeah, very
23.
young, isn't it, to have to make those
I
decisions?
hadn't had children. Obviously,
Yeah.
you think you're going to have children and you're going to
Yeah.
get, you think you might breastfeed, and all those things are sort of going
Yes.
through your mind when you've lost your mum as well.
Yeah.
Um, anyway, I did go forwards for the testing, and I didn't have BRCA1 or 2, which is obviously great news. But I did have other genes that meant that I was classed as high risk.
Okay.
So that's how I was then told that I would be put onto the be a high risk lady, as
Okay.
they call us, and put onto the annual screening program from age 35. So that's how I ended up here. So I suppose as a GP, what I often
Mm.
think is I spend a lot of time telling women about checking their own breasts and attending their breast screening, and actually it's a really anxious thing to do,
Yeah.
particularly if you've, for any woman, but I think particularly if you've got a family history of breast cancer, if you've
Mm.
lived through breast cancer with someone very close to you and you've
Yeah.
seen all the ramifications of that.
Yeah.
um, I do self-examine my breast once a month
Mhm.
or thereabouts, but I basically hold my breath because I'm thinking that I'm going to find something,
Yeah.
particularly since turning 40 and getting into the 40s. And I empathise with other women who feel anxious, but I think it's so important to do it because
Yeah.
I honestly believe if my mum hadn't found that lump, we wouldn't have had the extra years that we had with her,
Yeah.
because
Yeah.
her aunties hadn't necessarily had that time that she then got because she
Oh.
got treatment. So
Yes.
I think going for screening, when I go for my annual screening, I feel quite anxious. I don't want to go.
No.
I put it off sometimes. I say I'm too busy, and all of this
Yeah.
beyond the letter comes, and I put it off ringing, and eventually I go for it. and then you wait, don't you, for the results, and you think,
Yeah.
gosh, what
Must
is
be
that?
so hard.
Yeah,
Yeah.
and then the results
Yeah.
come, and I guess what I'm saying is, it is 100% understand why patients don't go, put it off, don't want to
Yeah.
do it, say it's not going to happen to them, but actually, it might well do. And I
Yeah.
think it's about what's the bigger picture here.
Yeah. And I mean, when you had all those discussions, did you then, were you offered risk reducing surgery? You know,
So I was told that if BRCA 1 or 2 came back positive, then I would be offered risk reduced
yeah.
surgery. And I made the decision that I would do that, but probably not until I'd had a baby. Um, but I would absolutely. I know you can't say, because when these things haven't happened to you, it's not the same, is it? But
No.
in my mind, I was adamant that I would have complete risk reducing surgery once I'd
Yeah.
had a child.
Yeah.
I was already married at this point. I got married quite young, so not this
Uh-huh.
was kicking into the long grass thinking this might happen in my 40s. Whether I knew
Yes.
I was hopefully going to have children in my 20s and then plan to have that risk reducing surgery. But when it came back that BRCAs were negative, they said that it probably was on balance um, a better idea to have the annual screening than prophylactic surgery. So
Okay. Yeah.
that's where
So
we ended up.
it's a, yes, it's a real balance, isn't it? A tough balance, isn't it, between having that anxiety waiting for the test, but as balanced with, gosh, it's quite radical surgery. It's a lot to think about when you haven't got a problem, as it were. It's and you're young. So it is a
Yeah,
really, must be
and
really
I think
tough.
everybody thinks about it differently, don't they? Everybody has a
Yeah, of
different risk
course.
perception and different, but
Yeah,
and I didn't have anything wrong, but I think having seen what my mum had gone through and the family had gone through with young children,
yeah,
it wouldn't have. I don't think it would have been a hard decision for me to make that decision.
yeah. No, is this the reason? Part of the reason why you went into medicine? Do you think? Did that have a big
Yeah,
influence on you?
it did. My mum never really hid any of her treatment or what was going on from us.
Yeah.
She was very open about it. She was a midwife herself, so
Okay.
um, she was very open about the treatment she had, the chemotherapy. Didn't hide any of that from us, and I did
Yeah.
spend quite a significant proportion of my childhood in contact with medical uh, services, etc. So
Yeah.
I think that probably did play a part in that, for better or worse, really.
Well, no, absolutely. I think it must be a huge asset to pay your patients, that you are, and you're a GP as well. And I was going to, well, that was my next question. How has all the, your background, how's that influenced your, going forward with the patients that you see? I mean, how's that influenced how you work now, really?
I think you just sort of, I think going through any life experience like that, and I don't want it to sound like I've been through tons of, because there'll be people on this call who've been through horrendous bouts of cancer themselves and are still going through
Sure.
that. So I've had a good life. I haven't had any thing to be sorry about. But I think just when you've experienced loved ones going through difficult cancer journeys and loss at a young age and so on, I think any
Yeah.
experience like that makes you a better healthcare professional,
Yeah.
because you can feel what people are feeling. Not,
Yeah.
it's not the same, but you can relate to the anxiety they have, the fear that
Yeah.
they have, the worry, the constant thought in the back of the mind that, you know, I sometimes think, oh, I've got, 6 years left until I get breast cancer, which is an absolutely ridiculous thing to sort of
Well, it's not
say.
ridiculous, is it? No, it's not really,
Any one of
because
us could get breast cancer today, tomorrow,
sure.
whatever.
Yeah.
But
Yeah.
you think about things differently. I think we're all products, aren't we, of how what the experiences that
Brought
we've
up.
been through.
Absolutely. Yeah, no, absolutely. And that's it. And like we were saying at the beginning, only genetic breast cancers only account for about 5 to 10% of all breast
Yeah,
cancers.
yeah,
It's We know, don't we, that it's we don't know exactly what causes it in most people, but we know that it's a female, being over the age of 50, because most as you get
mhm,
older the risk increases, and lifetime risk is 1 in 7 women. So we know it's a really common cancer in women. It can affect men as well. About 400
yeah,
men a year in the UK are diagnosed with breast cancer as well. But we know that the older you are, the more common breast cancer is, isn't it? So, but I mean, for you having had that experience, of course, it's going to be, it's going to sort of trigger you and make you feel, that that's uppermost in your mind. And of
yeah,
course, when younger women get breast cancer, it makes the news because it's such a shocking thing, isn't it? But again, it's much less common for younger women to get,
yeah.
younger people to get breast cancer. But of course, it can happen. But yeah, um,
Yeah, definitely. And I think sometimes you see patients who don't check their own breast because they're going for screening. Well, I'm up to date with my
yes,
screening, so
yeah,
I don't bother doing that because I always go for a mammogram when I get a
yeah,
cold.
yeah,
And it is still they need to go hand in
yeah.
hand. Don't they? You can't do one and not the other, really.
So even if you're having, that's what I was going to say. I mean, even if you're having a yearly screen, let alone a
Yeah,
3 yearly screen,
yeah.
it's not preventing you from developing breast cancer, is it? I don't want to scare people at all,
No,
but
no.
it's really important it just picks up, very early cancers that you can't feel and see. But uh, it's really important to check regularly so that you know you're normal. So if for you that's once a month, that's fine. For some, obviously,
Yeah,
older women or some women don't have cycles. It's about checking a few times a month
yeah.
to know what's normal for you. So you might have very dense glandular tissue,
Mm,
on one side and not on the other. If you know that's normal for you, that's fine. One breast bigger than the other, we're not perfect machines, are we? And quite often, we do look very different, especially when you've had pregnancies.
yeah,
So, it's about checking regularly, even if you've only recently had a breast screening, and
yeah,
we can't sort of specify that enough. But also it's really important for women to go for their breast screening
yeah.
appointments when they're
Absolutely,
offered them, isn't it? Um,
absolutely. Yeah,
and we have had a couple of questions through, actually. And one is from Rebecca. Can you have yearly screening if you don't know your family history due to um, you're an adopted child? Um, that's quite sad, really, because it doesn't sound like she's aware of her family history. But and unfortunately, you wouldn't be offered genetic testing, would you,
no,
on the NHS? But again, it's about being breast aware and checking yourself, because there's many women or many people that won't be offered genetic testing, aren't there? But
yeah,
for Rebecca, I think it's about if um, if if she's kind of worried about a family history, it's about going to a GP, isn't it,
mhm,
and
mhm,
talking it through. And if you've got any information, it's about taking as much information as you can. If you don't know about it, it's just about, I think it's more about being breast aware.
yeah,
And of course, people can actually, if they think they've got a significant family history about, um, what would you say to them if they came to you and they had
yeah.
all this information, and they had a, a lot of first degree relatives, so, and young people who had had breast cancer, a bit like yourself, dear, what would you say to them?
Well, I mean, I would refer them on to for genetic testing, but I think I would have that chat with them that it's not a given. I think sometimes people have very much written themselves off when they get to that point of knowing they've got family history, and
Yeah,
they're already not sleeping and feeling sick and not and worrying and making decisions around having babies and all the rest of it because they assume that they're going to get breast cancer, but as you
Yeah.
said right at the start, Addie, these genetic cases are the rarer form, and
Mhm.
it's not a given. And I think we see a lot of people as a GP who say, well, my nan had breast cancer when she was 80, and my auntie had it in her 70s. There is quite strict criteria about who we can and can't refer into the genetic screening services,
Yeah.
usually around, as you said, first degree relatives, in the younger age groups, sort of under 60s, definitely sort of 40s and 50s. We would refer to those services for them.
Do you, I mean, because you perhaps where you practice, you can probably refer them straight to, would it be the Christie? If
St
you
Mary's, yeah.
St Mary's, yeah.
Yeah, in
So,
Manchester.
but I think in a lot of the UK, they were in the initial stages. You'd be referring to family history clinics, wouldn't you? So that they send out a questionnaire to
Yeah,
assess their family risk, and they would see them in the clinic, and that's no problem. Usually, I mean, there are waiting lists,
yeah.
of course, but family history clinics are very good at sort of, assessing your actual pedigree your family pedigree to see if you are
Mhm,
eligible for genetic testing, which is,
mhm.
obviously a good idea if you're really worried about it. But
Yeah, really good
certainly,
point actually, because services for general practice and who we can and can't refer, and the thing where we can and can't refer to, does vary considerably
hmm
across, even within sort of the Greater Manchester area. I work in
really,
Bolton.
yeah,
If I go up the road to Rochdale, that might be different services and different criteria. So I think it is important to seek out what your local position is by
yeah,
your GP. Yeah.
yeah. No, that's really good to know. Um, I think this is probably, yeah. There's another question from Lana who's saying about, how can I reduce my risk of breast cancer developing if I've got a strong family history? And I think we've talked about the family history clinic taking as much information as possible so that they can see what your eligibility is for having testing. Um, I mean, of course, there are also implications, of course, aren't
Yeah.
there, for for people that go for testing, because I think people sort of say, "Oh gosh, I want to go for a genetic test," but actually there are implications in terms of insurance and things like
Mm,
that, aren't there? And and people do
definitely.
take those into account. If you
Yeah.
know, do you have much information about that yourself? And or
Only from personal experience. So things like life insurance, critical illness cover, occupational specific cover
yeah,
that I have, all takes into account. But I guess the problem is they take into account family history anyway. So if you have got a significant family history, then that would put your premium up anyway.
yes,
But what they
yeah,
wouldn't do is they wouldn't take the absence of BRCA one or two as a reduction in that. And
right,
obviously, the fact that I then ended up on the high risk list meant that that did put those things up. So yeah, it does
gosh,
do pay considerably more than probably I would otherwise have done, because of that. But the flip side of that is I get to have an annual check that I think is worth that
worth it for you. Yeah,
for me.
absolutely,
Everybody's
and yeah.
different, aren't they? But it's worth absolutely.
Absolutely. And we will be putting we can put some links for help with the impacts of insurance, the Association of British Insurers, and we can put and the Genetic Alliance UK. They all kind of help with things like the possible impacts for insurance, because I think that does need to be taken. Again, it's a balance, isn't it? And
Yeah.
it needs to be considered, doesn't
And it's
it?
an individual decision, isn't it, about what you perceive
Yeah,
benefit and risk to be, really.
yeah, no, absolutely. And I think, in terms of our services that we offer at Breast Cancer Now, we have our Someone Like Me volunteers, who are amazing. We have a mixture of volunteers that have had the BRCA gene with with that have had breast cancer. We've got people that on our books that are a BRCA 1 and or 2, and they haven't had breast cancer. So and we have a mixture, and we will put the numbers of the Someone Like Me. We'll put the links for the Someone Like Me team. And again, if you want to know more about that, please do give our helpline a ring. One of our nurses will be really happy to talk it through with you. Or if you've got any questions or comments about family history and high risk screening, um, because we know it's a very complex
Yeah.
business, isn't it? Family history. It's not just straightforward. So people might have specific questions. Um, like we said, there are other genes that can increase your risk of breast cancer, and people might be worried about that they have those genes. And they want to talk it through. We also have a really good document here called, it's probably back to front now, isn't it? Family History of Breast Cancer, Managing Your Risk. And it's got all sorts of really useful information for anybody who wants it. They can either have it via email, or if they give the helpline a ring, we can send you that information. It also has a list of really good organisations at the back that such as Force, which is a support organization. I don't know if you're aware of them, Helen, but they're based in the US, but they're
Mhm.
amazing. It's about support for anybody facing any hereditary cancers, and it's got a lot of information
Yeah.
on their website. So yeah, so honestly, there is a lot of support out there, but please don't feel that you're alone or you can't ask anything. And if you are worried about, if you do find anything, if you're breast aware, you find anything, any changes at all in between screening, or you've found a lump that you're not sure is new or different, or any symptom, you should always report it to your GP.
Yeah.
You're not going to be
100%.
wasting anyone's time, and they can assess you. And someone like Helen will see you or speak to you over the phone and bring you into the clinic. And if you need to be referred to a breast clinic for further assessment, then
Yeah.
that's what they'll
And I
do.
think with the current state of primary care, and I know there'll be
Hmm.
people on this call that are thinking, well, it would be good if I could get in with my GP, no doubt, because that comes up a lot. I think, it's difficult, isn't it, sometimes to tell the receptionist what you're ringing about. But I think
Yeah,
I would feel fairly confident that if you tell a GP receptionist that you found something in your breast that you are worried is cancer,
yeah,
you will be seen as a matter of urgency. And we do not take that lightly as GPs,
no,
not just me, but any others. We would always, always rather see a lady and refer or not, whichever the case may be, and it turn
yes,
out to be nothing
yeah,
than it turn out to be breast cancer. We don't want it. I've had ladies where I've referred them and they've said, I've seen them again for something else, and they've said, I'm so sorry I wasted your time. It turned out to be nothing.
yeah,
That's the best news ever
yeah. Of course it
that we can
is.
get. If I get a letter back from the breast
Yeah,
clinic and say I saw this lady and actually it turned out to be just a cyst, or there was
yeah,
nothing there,
yeah.
that's fantastic news. I will never ever think that you've wasted our time as GPs for that. That's the news that
No,
we want to see.
of course, and that's so lovely to hear. Because yeah, I think people are still very scared to sort of approach, because they know that you hear it on the news, don't you? That what a how overworked and sort of really stretched you are. But like you say, it's so important. So important, if you've got
Mhm.
a worry, not to feel that you're
Mhm.
isolated or alone, isn't it? And go and
And it's not
report
just
it. So
lumps, is it? It's other things,
no,
skin
that's right.
changes, nipple
Not just a lump.
changes, changes in
Yeah,
size or shape, anything that's not normal for you.
yeah.
Please come and tell us about it.
Yeah, no, that's really good. And again, if you want to give us a ring on the helpline, we're there for anybody affected by with anything, breast health conditions or breast cancer. So it's not just about breast cancer, but yeah. So do give us a ring. The other thing is, if you wouldn't mind completing the survey, we like to evaluate the service and see, to assess how we're going with these Facebook Live sessions. So if you wouldn't mind doing that, that would be great. So I'd just like to thank you again, Helen, for giving up your evening to talk to us. And it's so lovely to, well, it's lovely to hear your, you're you're an inspiration. You are, because your story will resonate with people, I'm sure. And actually, no, it's been really lovely meeting you and
Thank you.
online.
Thanks
Yeah,
thanks for
and
having me here, and
not at all.
yeah, to
Um,
everybody on the call who's struggling with breast cancer or fearful of breast cancer, just my heart just goes out to you, because it is, it's horrific, isn't it?
It is, but hopefully for most people that will be, there'll be an end goal, and that
Yeah,
will be a, a good outcome for,
yeah,
the earlier we find these cancers,
absolutely.
the better the outcome's likely to be, isn't it? So thank you once again, and thank you for everybody listening. Good night. Have a good evening.
Good night.